This is each topic is important, of course, but prostate and male health, I think, is important, one of the major important ones, because I think when we're strong as males, we carry out our responsibilities more effectively, and I think it's important that that dichotomy or that polarity is there between male and females. I think it's important. There's quite a lot of I think demasculation in our society nowadays, and I think it's important that male health, male hormone is there, and prostate health is there, so that we can be strong males to do our part, make decisions, go out and slay the dragon, bring home the beef. You know, I think that's what's in our DNA. So I think it's important that we have good, strong testosterone and growth hormone and so forth to allow that to happen. So my name is Troy Giles. I'm a chiropractic physician specializing in health and well-being as a coach, and I coach other doctors as well of how to create wellness centers and support them in that way. But tonight we'll be discussing the prostate and what are the major issues with the prostate and male hormones and protocols that that are there for us to treat our patients with. So we'll be discussing the common problems, conventional medical treatments, which are scary. It makes me almost afraid to have a prostate for some of these different medical procedures that are there. I want to try to hit and support my male patients before there's a need for some of the radical things that we'll discuss here in a minute. And then natural holistic perspectives. And then with male hormones, we'll discuss the different conditions of male hormones and their treatments, and then ultimately the protocols. So a relatively small male organ that can cause big problems. So the prostate sits kind of in the anterior lower pelvis, just before the urine would exit or the semen would exit and head into the penis. So it's right there, just close in the anterior part of the lower pelvic area. It can be palpated digitally, and that's how we're able to determine oftentimes if there's benign prostatic hypertrophy or enlargement of the prostate. So the male reproductive organ that functions to secrete prostate fluid as one of the elements of semen. So literally it's about 90% of the seminal fluid is from the prostate. The other part then would be the sperm, but this gives the sperm something to swim in, and it's a fluid that helps to transport the semen up into the uterus from the vagina. A normal prostate measures approximately 3 by 4 by 2 centimeters, so it weighs about 18 grams. It's shaped like an acorn and has muscles that help to propel seminal fluid during ejaculation. So that's all part of the process, mixing with the sperm held in the vas deferens, and then during the ejaculate mixing, coming through and mixing in with the seminal fluid from the prostate. So common prostate problems: benign prostatic hypertrophy, BPH. This is just an enlargement, inflammation of the prostate with oftentimes extra cell, extra tissue growth. Prostatitis is another one, so just an inflammation of the prostate, and then prostate cancer. So those are the main things we want to look towards. Benign prostatic hypertrophy, enlarged prostate. So the numbers, ages 31 to 40, 1 in 12 men have that. Ages 51 to 60, 2 out of 3, and over 80, more than 8 out of 10 have enlarged prostate. Now I was taught in chiropractic college that most men over 90 have the beginnings, if not prostate cancer, but don't die from it. It's usually they find it on autopsy. So according to medical doctors, only half the men that have BPH need treatment. But I would suggest if you have BPH that, of course, you want treatment from what we do. Now treatment, that doesn't mean, in my mind, conservative, of course, would be hitting with herbals that we'll talk about in a minute. Kegels, which is a contraction of the pelvic floor muscles that contract around the prostate and the bladder as well. So the way I explain a Kegel is if you were urinating and had to stop midstream, somebody was coming up a trail or something you were urinating out in the bushes and you heard somebody coming, stopping your urine midstream is a contraction of the pelvic floor muscles and stoppage of the urine flow. That's a Kegel. So you can contract the prostate and the bladder as well by stopping or contracting that muscle. So that's part of what you would do with BPH, is contract that muscle, and that keeps it pliable. So that's one of the concepts that we'll discuss here in the treatment. Testosterone levels do not appear to have an effect on BPH. So as your testosterone levels drop, doesn't mean you're going to have enlargement of the prostate. They do coincide, however, because our testosterone drops as we age, and as well as our growth hormone, as we'll see in another slide. So BPH may lead to chronic urinary tract infections, which can then lead to upper tract dysfunction and then cause renal issues as well. So if you think about in this picture to the right here, where the prostate is squeezing in on the ureter or the urethra, it's not allowing for full emptying of the bladder, which then can cause fluid, or it causes urine to back up into the ureters and up into the kidneys. That's how that would progress. Further complication may also induce stone formation. So if you're not emptying out, you're not getting rid of any salt, mineral stones, and so forth, that could come down from the kidney as well and get lodged in the bladder. So having this restriction in this area is a real problem. So this is BPH symptoms. So look over here on your right now, interruptions in the urinary stream, midstream stopping, frequent urination, especially at nighttime, because now this is causing pressure up onto the bladder. So you're having to get up more often. It's like there's not as much area. Hesitation before beginning to urinate, a feeling that the bladder is still full after urinating, terminal dribbling after you've finished urination. It's almost like the sphincter isn't able to control it, and you can still urinate as well. An urgent need to urinate, and then weak stream. These are all concepts. So the first is then urinary retention, weak urinary stream, and interrupted stream. Second symptoms, or secondary, then would be increased frequency of urination, urgency and incontinence, and then the tertiary symptoms would be infection. So that's a good explanation, a good visual there. Conventional treatment for BPH, drug therapy then unconventional would be alpha blockers. They're designed to relieve tension around the urethra, like Flomax. So some drugs are designed to reduce the size of the prostate, such as Avodart. So a difference between those two, causing the muscles to relax one, and the others to diminish the size. So recently, FDA has begun to require these drug manufacturers to include a warning on packaging that states that these drugs may be linked to an increase of prostate cancer. So that's not too exciting. I want to deal with something, a natural concept. So now surgical treatment, this is where I don't want to go. So invasive surgeries, have the prostate taken out, that's prostatectomy, hot water thermal therapy. So basically you just scald it, the opening to diminish it. My father had this treatment and it seemed to work pretty well. However, it was very painful for probably 3 or 4 weeks for urination after that time. Prostatic balloon ablation or a stent, transurethral needle ablation. So that would just be a needle coming through, and ablation means a burning. Microwave thermal therapy, TUMPT, that's interesting, to destroy tissue with heat. Laser surgery or green light lasers to vaporize excess tissue of the prostate with varying degrees of success. So it doesn't look too happy over here. There's also one called a TURP, transurethral prostatic resection, and that's like basically taking a rotor-rooter, a spinning blade, and you just take it through the center of the prostate, making the urethra larger, and that's painful. I can't even imagine urinating after that. So prostatitis now, inflammation of the prostate, usually occurs in men over 50 by bacteria entering the urethra. It can come from backward flow of urine, stool, or sex. Prostatitis is when the prostate becomes inflamed and the inflammation does not subside or becomes inflamed frequently. Similar effects of BPH occur with difficulty in urination, such as frequency or urgency. And then a major difference is the addition of a burning feeling and pain, which can also extend to the growing. So that's an inflammation. So symptoms then, fever and chills, burning pain during urination, frequent need to urinate, pus discharge from the penis, pain in the groin or orgasm, tiredness, and depression. So anytime there's an increased pressure through there, that's going to be a lot of pain. So with urination can be painful and orgasm as well. Conventional treatment then for prostatitis, conditions are ranked as either non-bacterial or acute or chronic. Prostatitis is usually treated with medications, so antibiotics. Bacterial infections that are acute or chronic are treated with the antibiotics. Non-bacterial treatments utilize the same anti-inflammatories as in the BPH. So just trying to diminish the inflammation, of which we'll be doing the same thing, just naturally. So we're thinking about anti-inflammatories, natural and antibacterials. Fungal and parasitic are as well. They are things to think about. Now, cancer of the prostate. After skin cancer, prostate cancer is the second most common cancer in men. 1 in 6 will be diagnosed in their lifetime. Prostate cancer is slow growing. So you can pick it up, in your 80s and still not even really treat it because it's so slow growing. 1 in 35 men die of prostate cancer. If father or brother has prostate cancer, it's more than doubles your risk of having prostate cancer as well. And for some reason, it seems like African American men get hit with a lot of different diseases. It's almost like they've got a greater preponderance, and it's too bad that that's the case. So African American men are 1.6 times more likely to get prostate cancer. They're 2.4 times more likely to die from prostate cancer. So leading cancer types for men in the United States, here it goes, 26% of males have it, prostate 9% of males. So these are estimated new cases per year. So that's quite a bit. On a positive note, prostate cancer-related deaths have gone way down. So that's a good thing to know. And it could be maybe we're trying to stress more fruits and vegetables and things that will help to diminish antioxidants and so forth. So cancer of the prostate often has no symptoms, usually discovered after a lab test where you screen the PSA. So that's prostate-specific antigen. And advanced cases can cause urine flow and obstruction. So the risk factors for the cancer of the prostate: age, familial history, hormones, race, dietary fat, multivitamin use, dairy and calcium intake, cadmium exposure, and dioxin exposure. More men die with prostate cancer than because of it. They die with it than because of it. So 80% of the prostate cancer is discovered at autopsy, like I was mentioning. It's slow growing. 16% are diagnosed during their lifetime, and only 3% will actually die of prostate cancer. So it's there. We need to be paying attention to it. But I'm probably more concerned about the BPH and the urine flow diminishment and backing up into the kidneys and so forth than I am the prostate cancer. But I think we can do things as men to be proactive for it, and we'll discuss that here in just a bit. So yeah, Hollywood News, Ben Stiller reveals fight with prostate cancer. So on October 4th of this year, comic actor reveals he was diagnosed with prostate cancer 2 years ago. He credits the PSA blood test with saving his life. He had no family history. He said, "If I had followed the U.S. Preventative Services Task Force guidelines, I would have never gotten tested at all, and not have known I had cancer until it was too late." So the PSA, I think, is the way to go. After 50, you need to get that checked and see your levels there. And this was a little bit of a joke. Is it coincidence? Maybe. Prostate cancer incidence peaked during the Clinton years. So male cancer incidence rates from 1975 to 2009. So you never know. That's just a little joke there. But there was actually people that when we were creating this that we actually were trying to create a conspiracy theory that somehow that Clinton and his lifestyle had increased that somehow. Anyway, conventional treatment, according to the American Cancer Society, because prostate cancer causes are unknown, they cannot be prevented. So I still feel like I know more of what that chronic BPH and prostatitis drops the immune system in the area, and because the prostate is so far out into the colon, it has the ability to be hit with many layers of infection. And I find a lot of times that it's a fungus or a parasite that creates the inflammatory issue. So I think that if we can get that inflammation out, treat the layers of infection, we're going to be on our way to preventing it. But we'll discuss that in a minute. So the treatment of prostate cancer depends on the man's life expectancy. If he's 80, we're not probably going to mess with it because he's only going to live another 10 years, and it probably won't affect him, kill him. So treatment is further decided after a biopsy is then graded on a Gleason score, which is a score where it's rated to determine the eligibility. How intense is that? We're here now on conventional treatment, so the radical prostatectomy is most often recommended by urologists. So that means taking the prostate out. So it causes considerable post-operative pain and complications. Most patients are permanently sexually impotent, which is a big deal for most men. But that would be with cancer. 5 to 30% will suffer from some degree of urinary incontinence. And recovery time, which is rarely complete, takes about at least 6 months. So one of my good friends had some prostate cancer and had it taken out, and he had to wear a Depends or a diaper for at least 6 months. But you know, at this point, if I had cancer, would I take it out? Yep, that's what I'm going to do. I'm going to have that taken. But I'm not going to, so don't worry. We're not going to go there. Just talking to my subconscious there. External beam radiation. So this is a long list of complications. Too many to list, but that's just basically radiation externally. PAACT or hormonal therapy is another thing that they do with the cancer. And brachytherapy is inserting radioactive implants. So like little beads here, and that's what the picture is showing here. And putting in little radioactive beads into the prostate, which can fight the cancer as well. And then cryosurgery is freezing the prostate. So I don't want to look at that. Let's now look more at holistic approach to prostate problems. The following tips and lifestyle changes can improve any of these 3 prostate problems. Some herbal medicinal treatments for prostate conditions also overlap. So if somebody is undergoing therapy medically, we can also hit them, support them holistically. So the number one thing is education, teaching men what to do, how to support the prostate, Kegling exercises, and so forth. Healthy diet, supplementation, natural remedies, low saturated fats, high fruits and veggies, decrease alcohol, caffeine, refined sugar intake. Again, the refined sugar creates inflammation. Adequate fluids in the body. That's going to help anything, but just getting that fluid to pass, because that organ many times isn't active. Maybe this person isn't sexually active anymore. So just fluids to help things move better. Stay active, exercise, including pelvic strengthening exercises. That's the Kegel. Good hygiene, including keeping the penis clean. Urinate when the urge strikes, don't wait. Suppressing the urge over time can irritate the prostate, because that's basically, you know, trying to hold it back. There's a lot of pressure in the sphincter of the bladder, which is right there next to the prostate. Teach men prostate health in the first place to avoid problems or problems becoming serious. Alternative BPH treatment. So test clients, you use the electrodermal screening so I use the Asira, but that's a testing tool that we can check energetically. Kinesiology, lab work, you know, send for a PSA test. Be aware that the prostate can be attacked by other things such as fungus and parasites. Again, because the prostate sits in the colon, it can be affected by fungus and parasites. So fungus is a very common thing in the colon, as well as parasites. So if a fungus or a parasite gets in the prostate, it will increase and inflame it. So we have to think about using Fungex and the microsite or Paramac. Look for the usual layers of infection. So infections in other locations can lead to prostate issues. An example, infections in the colon may impact other organs and systems. A healthy colon is vital to healthy prostate function. So think about that. Half of the colon or half the prostate is palpable through the colon. So whatever's in the colon is going to be able to be affected in the prostate. Support the endocrine system. Think about what the male needs. Supporting that, we'll go over that in a minute, but hormonally, what does he need? Manifirm is one that's very effective. For prostate, we'll talk about that. Support emotional health. Just overall well-being. In addition to the testing methods previously described, the following may also help prostate. So hot baths, just to be able to relax the area. Bed rest, drinking extra fluids, learn to relax when urinating. Ejaculation regularity. I think that's very important to move that. Remember that the seminal fluid comes from the prostate. So if you can move that fluid, that's what I teach patients as well when they do come with a prostatitis or BPH, is to have a regular sexual relationship if that's available. That'll just, again, get that fluid to move. Holistic approaches to cancer then. Because of the slow nature of the prostate cancer, all prostate cancer patients should use alternative cancer therapies. So alternative therapies will avoid the many side effects of conventional treatments. If conventional treatments are used, alternative therapies will still improve the result. So I always tell patients, if you're in cancer treatment, we can always support that organ that you have the cancer in, or the organs of elimination, the colon, the kidneys, the liver, lungs. So there's a wide variety of factors that can cause prostate problems. We use a wide number of treatments to counter. So in addition to the previously described list of holistic health tips, hormone balancing, supplements, vitamins and minerals, safe water free of chlorine and fluoride, fresh air, sunlight exposure, stress and emotional management, detoxification, immune strengthening, and chiropractic, massage, and acupuncture. So real quick with chiropractic, realizing that the spine is a conduit of the nervous system and the immune system. So if there's a misalignment down at L5, which is the #1 disc to diminish in height, chiropractic adjustments will help keep that area mobile and moving. And also decompression of the area, pulling the vertebra apart, is also very important, and that can be done at your chiropractor's office as well, or an inversion table. So pulling those discs apart will increase the neurologic flow to the colon, the prostate, the bladder, all the way around. And in fact, I would suggest that a lot of the people that are taking Viagra for sexual activity would have low back issues, where they're diminishing the energy from the L5 vertebra and the nerve root, basically the lumbar vertebra. If those are diminished in energy to the area, they're going to have troubles with increased blood flow. So when you look at the side effects of Viagra, it's just, that's not something I want to do. So men's health. The male sex hormones and their levels can have a big role in a man's health. After age 20, growth hormone and testosterone levels drop 14% every 10 years. So at age 40, he has lost half of what he had at 20. At age 80, he's left with only 5% of his original growth hormones. That's pretty intense. So that's a great visual over here on the right. Male testosterone production with age. So signs of male hormone imbalance is energy levels drop, weight around the belly, mood swings, fertility, hair loss, interest in sex or low libido, increased body fat, depression, mood swings, night sweats, so forth. So there's a lot happening with that. So drastic changes in testosterone levels can also be caused by thyroid, diminishment of the thyroid, or cancer, autoimmune issues, inflammation of the testicles, genetic irregularities, medication side effects, and so forth. There's just a lot of effect with low testosterone. So testosterone usually begins to fall naturally after the age of 30. Drastic decrease in testosterone can lead to all of these symptoms you're seeing here. I mean, literally mood swings. This just looks like menopause, and that's exactly what it is the male going through a menopause as well. So caution, practitioners often mistake symptoms of hormone imbalances with signs of aging. So watch those hormones. So when we're talking about layers of infection now, specifically in the prostate, and it can be even in the testicles as well, or in the bladder. Think of back to what sort of the bacteria Prostatitis, it can be the reflux, like I was mentioning, of urine back up into the prostate, into the bladder, after, with sex or holding urine too long. Lymph-X is one that's added here now. That's one that just came out in June, that helps dilate and open up lymphatics. So anytime we have swollen area, Lymph-X is going to help dilate the lymphatic and get that to drain. Meta-X for metals, Microcyte for the small parasites, Paramac for large parasites, Fung-X for fungus, and Viro-X. So you must do kinesiology to determine what layers of infection might be there, if there is any. But I would suggest that 100% of men with prostatitis or BPH or cancer have a layer of infection. That's what I would find in my practice. So, Prostate is a support for the prostate. Herbs combined to treat urinary and reproductive issues. Therapeutic herbs that can stimulate, strengthen, or regenerate cells. Plant sterols and different fatty acids to balance hormones. Block DHT and soften tissues. Inhibit microorganisms and protect from fungus. Now, with the different types of minerals that are important here as well for prostate, the K-comp, the motility, both of these have vitamin K2. And these are often misunderstood. And so by taking the motility and the K-comp, we're increasing the potassium and K2. Now the zinc is very important. That's very, very, very important for testosterone and the DHT. It also is very important just overall in prostate health. So these three here are very good for overall vitamins and minerals. The histamine is the supplement that we use now for anti-inflammatory or histamine when there's an increase in inflammation. If there's something that's causing an allergic issue, it also helps as natural anti-inflammatory as well. So this would be effective in BPH and prostatitis. So another one to consider would be the Cardiar. Cardiar is a dilator of arteries. It helps to decrease the plaquing. It helps to dilate the vessel, and it smooths the inside layer because it has the arginine, 5,000 milligrams of arginine, and the 1,000 milligrams of citrulline. That's very effective at opening up and dilating. So arginine is usually given to men during conventional prostate cancer treatments. So some forms of cancer treatment suppress these amino acid roles and functions. So Cardiar is just anytime you're thinking of vessels, vascularity, very important there. Manifirm supports the male. This would help testosterone and overall male hormone. The Adrenix supports the adrenal gland, and that's going to support the growth hormone and just the overall energy. Immunis would support the compromised immune system, so Immunis would go very well with any of the layers of infection. And in the probiotics, of course, we want to get the good bacteria back in the gut as well. So Leptera has good bacteria. Vivaprofen has good bacteria with anti-inflammatory. And fluorescein is just a very good count of good bacteria. So whenever you're thinking of inflammatory in the bowel, I use the Vivaprofen, and then subsequently the fluorescein afterwards for just getting large amounts of good bacteria in. So again, the protocols, these you can read across here and see what the protocols, 1 to 4 capsules daily, but always dose your patients with kinesiology. So for prostate, Manifirm for testosterone and overall health. Hypothala is a hypothalamus controlling all of the endocrine system, which then communicates with the pituitary, and it then sits as the master gatekeeper, then affecting the thyroid and the adrenals and on down. I would absolutely test. I couldn't remember the name of the gland, but that is a lubrication, and I would think the same. Now I don't know if Prostate would be, but I would test that. I would imagine this is just now my imagination, that the prostate, again, it has lubrication effect and overall liquid amount. That Skene's gland would be that possibly could affect that. I would just kinesiologically check for sure. Then I would think about, for females, think about FemiFirm, supporting the female there too. Interesting. I don't know that I would like to have my prostate massaged, however. And I would imagine digitally it would be the only way you would be able to reach in and do that. However, the Kegel is, that's what you're doing. You're squeezing, contracting, and that's a good way to contract around and give the prostate a massage, if you will. But digitally, that's that could happen as well. That's a good, anything to create more blood flow, and that's going to get in there and move the fluid out. So that's a great idea. So in that case, I think the prostate massage would actually get in and move some of the calcification and crystallization of the fluid. That's great. So that's why I think it's so important to have sexual activity, because that's just getting that to move, contracting it and moving the fluid through so that it's not sitting there crystallizing. That's a good point.